if you tend to get depressed in fall and winter, you may want to listen to this conversation. I'm here with Dr. Jill Emanuele in New York City. I'm here in California, and we're here to talk about seasonal affective disorder. So, can you tell us a little bit about yourself?
Yes, hi. It's so nice to be here, Ken. Thank you so much. My name is, as you said, Dr. Jill Emanuele. I'm a clinical psychologist, and I have a practice and business in New York City called Urban Yin Psychology. I see children, adolescents, young adults, and adults with mood disorders and anxiety disorders. And one of the things I see, especially at this time of year, is a lot of people complaining about their mood going down, maybe more so in New York City here than in Palm Springs. But but definitely this is the time of year that people start to feel bad. And it's not just about the holidays. There's other reasons that people can get down.
Well, I'm here in sunny California in Palm Springs, which is more sunny than most places in California. And you're in New York, the climate is cold. Can you tell us a little bit about seasonal affective disorder and why maybe certain parts of the country, certain parts of the world are more affected than others?
Yeah, absolutely. So seasonal affective disorder, interestingly, is technically no longer qualifies as a distinct disorder in our new Bible of diagnoses, if you will. It's actually a specifier for depression, but there's still a very distinct profile for seasonal affective disorder. So depression is a type of disorder that people feel sad or irritable most of the day, at least for 2 weeks. They may feel down, they may feel frustrated, hopeless, they may feel sad or guilty. Sometimes it gets to the point where they start to feel suicidal and really feeling like they just don't like themselves very much and life is very hard. They also feel often not having a lot of energy. So with the thing about that is that can occur any time of the year. With seasonal affective disorder, you can get those symptoms, but they typically come on during the winter months. Now, there is a pattern that's also summer related. I can talk about that later. But the general pattern that we see is having some kind of depressive symptoms that come about during the winter months and are distinct from the holiday blues. You know, a lot of people get sad during the holidays for different reasons. This is different. It is definitely found around the world, but much more likely to occur in environments. The further you are away from the equator and the colder it is, the more likely that could be prominent. And it's linked to really daytime hours. The theory is that there's some kind of impact on the circadian rhythms, would then impact hormone levels and then impact mood. So that is the general gist.
What about climates where it's not necessarily really cold, but rainy? So I'm thinking like in Portland and in Washington State, where it gets rainy and it gets chilly, but not like Minnesota or Chicago chilly.
Right. I don't know that I'm not aware of distinct studies that have looked at like that kind of difference with London gloomy, Portland gloomy, that kind of thing versus just a cold environment. That being said, I think again, you have to really focus on the daytime hours and how much light you're getting. But in those cities, you don't get as much light comparatively to some of the, especially Palm Springs. But you don't get as much light. So that could absolutely have an impact in some kind of way.
So short of people just moving to Palm Springs or moving to warmer climates, what can people do
Right.
when they experience more mood that's sad during those fall and winter months?
Right. Before I even answer that, I'm going to just add a few more things that I think are important to know about the distinct profile of seasonal affective disorder. There's a
Sure.
couple of symptoms that occur that are very specific to it. So you see even more oversleeping. You may see overeating, which you do see in depression, but it's actually especially carbohydrate cravings. And sometimes the withdrawal into, especially in winter, really there's like almost like a hibernation. People will sometimes really just not come out of their beds or come out of their houses in some kind of ways. Another thing I've seen clinically, but isn't always mentioned in the literature, is that people become more rejection sensitive. So people that are not as worried about what others think of them, they may actually start feel like others are not liking them or feeling bad towards them in some kind of way. And you do see that in depression, but sometimes you see that more in seasonal affective disorder. So what do you do? So the first thing is it's really important to observe the pattern over time. So what we look at is if you've had at least 2 winters or 2 cold seasons where you've actually had these symptoms, then it's probably qualifies for the diagnosis. And so what you want to do is prepare in advance. There's no time like the present, especially in the fall, to be like, okay, what can I do to help myself towards the winter? So the first thing is there's a couple of different ways that this is treated. One is with cognitive behavioral therapy, which we use to treat depression. So it helps to look at some of the thoughts that are associated with having depression and also this pattern. Some people decide to go on medication. So we know that serotonin specific reuptake inhibitors, SSRIs, are the medications that are of choice for depression and mood disorders, or I should say depression. There's other ones that are specific to mood disorders. And so sometimes people choose to be on an SSRI during that time. There's also light therapy. There are very much people use light boxes to help increase the amount of light that they're exposed to improve their mood. I want to be very clear that there are light boxes available on the market. I really, really strongly recommend you consult with a doctor, and because there can be negative effects for certain people to have the exposure to that much light. So it's very important that you consult with a doctor and getting recommendations for light therapy. And then the
So
final
light boxes are something that you purchase. There's not a clinic that you go to, like a tanning salon where you sit under something.
you generally can purchase it and you're done at home. In fact, some of them are very clever. They're like desk lamps that you can use, and you can have it on while you're working. So it's not like you have to sit there and just stare at a light the whole time. Like you could actually be productive while you're doing it, or on the computer or something like that. The fourth thing is vitamin D. Again, consulting with a doctor on the amounts of doses and what's appropriate or what your vitamin D levels are, but that has also been associated with seasonal affective disorder.
And in terms of what people can do on their own, so behavioral therapy is the treatment of choice. So they can seek
Yeah.
out a therapist who specializes in the treatment of anxiety. And here at the Anxiety and Depression Association of America, everyone who is associated with this organization actually specializes in the treatment of anxiety and depression. So you can seek out therapy from someone here on this website. But what can people do on their own to help?
Yeah. So one of the things that we do with depression in general is something called behavioral activation. So when you feel depressed, it's really hard, and you could do this in therapy too, but it's really hard to really get yourself moving in some kind of way. So it's really important to be active in some kind of way, even if it's not like, it doesn't have to be active like you're leaving the house and running a marathon. It's just, maybe you're going to go to a coffee shop, or maybe you're going to go take a walk somewhere, or you're going to get out of your bed and read a book, or watch TV or something that is more than just staying in bed. Maybe you schedule yourself it's important to socialize when you feel down and sad and not isolate yourself. Maybe you schedule time with a friend or to talk to someone on the phone. So there's things that you can do to just take baby steps to be more active when you feel really terrible. So that helps to improve your mood.
Yeah, the word depression it's an emotion. Depression is an emotion. And if you look at the word emotion, it has the word motion in it. And so if you want
Yeah,
to change your emotion, you got to
yeah,
move. You got to
yeah.
get out of bed, make your bed in the morning. If you make your bed the first thing, you've accomplished something right away. Makes you feel a little bit better. And then, yes, get moving, maybe do exercise, get out of the house. Even if it's cold out, even if it's cold,
Even if it's cold, like and here in New York City, it's a little more daunting because you have to not necessarily jump into a car, but especially from most parts of the country or the world, like you people have access to cars, you can get in a car and go somewhere as well. I will say also, even just like you mentioned, making your bed, some people are like, I don't even have the energy to do that. Okay, just pull the covers back, like take baby steps to be able to do that. Even if you don't throw the pillows on, even if you don't change the sheets, just like take some kind of step so you're in motion, like you said.
yeah, you have to move your body, right? And when I think about someone who has, let's say, the flu or a physical illness, the idea is that you rest, you stay in bed, and then when you feel better, you get out of bed. But with depression, you have to force yourself out of bed.
Yeah.
Then you start to feel better, right?
Yeah, it helps to at least get it in motion, and it's not so easy, and you go through ups and downs with that, but for
Yeah.
sure getting in motion is better than staying still in this case.
Yeah. And then, like you said, scheduling friends, meetings with people and socializing and just talking and things like that.
Yeah, or even just texting. If it's too hard to do those things, just be in touch with somebody.
Mhm. Yeah,
Yes.
don't be afraid to reach out. And
Yes.
anything else that you might want to recommend when people are feeling down in the wintertime?
Um, yeah, I think it's really important to like talk is my that socializing piece and talking to someone is really important. And the other thing I would say is that winter is a time of rest. So it's also, for even though we don't necessarily practice that all the time. So it's a matter of just remembering that this is it will probably get better, even if it doesn't feel like it's going to get better. It does remit in some kind of way. And there's a way to address, even if this year is hard, next year you can address it ahead of time because you know it might be coming.
Yeah. To remind yourself it's temporary because when you're in it, it might feel like it's going to last forever.
Correct. Yes, exactly.
All right. Well, thank you so much for taking your time out of your busy schedule to chat with me and have a warm and sunny day.
I will. You have one as well. Thank you so much for having me.
All right. Thanks.